Well, good morning.
Here we are already.
Good to see you all. And the team's coming in here for rounds, and thank you for giving your permission for us to film this today.
Hello. Hi.
Good morning.
Hi.
Right.
Well, you look good. You look great.
Everybody says that.
Oh, we need Levi.
Yeah, we got Levi.
Oh, yeah, we need Levi.
Oh,
How can we forget Levi?
Hey, he's been
Are you
here.
getting him?
He's been a prince. We've had such good results, and just the professionalism of the staff is absolutely amazing. They give us care like they care.
Oh,
They do care.
so Mr. and Mrs. Tremblay, thank you for allowing us to make this video today. And on Thursday of this week, there is a webinar presentation that we're going to do for people all over the country that are interested in collaborative care. And you all have been in the hospital here for too long now.
Yeah.
And you
That's
sort
not
of
anything.
know this. We're so happy you're doing so well. And we're just going to do a normal rounds, just like what we've done all the days you've been here. And I'm just going to take a little video of kind of everything that's happening as we're doing that, if that's okay.
Fine.
Okay,
Fine with us.
great. And thank you for your permission for this. So we're waiting for a minute for your nurse, Levi, to come. And who's tracking him down? Lance tracking him down?
Michelle, the night nurse, absolutely marvelous people. I get a little cloudy when I talk and think about it, because these people are so good. I'll play you.
Let me take a picture of them here while we're waiting. So why don't we start with some introductions? Would you mind as we go around?
I'm Betsy, I'm the pharmacy resident.
I'm Maggie. I'm one of the ICU pharmacists.
I'm Noni. I'm a chaplain.
I'm Angie. I'm the nurse practitioner.
Matt, physician assistant.
And you know me, I'm Paul Eulig. I'm your surgeon's partner. Dr. Tim's your surgeon.
And I'm Kathleen, the wife.
Great.
And I'm Ron, the husband.
Great. And we got Lance.
Oh, Lance Kruger, physician assistant.
Levi coming?
He's starting IV.
Yeah, okay. Well, we'll get started.
Okay. Well, can you just bring us up to date over the last 12, 24 hours? What's going on and how you're feeling?
Well, I've been here since March 15th. That seems like 3 weeks. But it's been 3 weeks. And I've had really good care. I keep looking at this pillow, and they give us the heart patients. I think that's a terrific idea.
Well,
Have you
that's
used it
good.
yet?
Oh, yeah.
Yeah.
Yeah, I'm getting out of here. They put this belt around me and plug the pillow.
Hey, Levi.
Hello.
Now comb your hair.
Always late to the show.
How's Levi this morning?
Good. How about you?
Good.
Good.
And everybody knows Levi at Levi Nurse.
Yep, I'm
Oh, yeah.
his nurse. So,
Well, can you update us over the last 12, 24 hours?
okay, so we took him off CRT yesterday. Got rid of his femoral dialysis catheter.
Yay!
And so now, obviously, he's able to get up into the chair. And he did well with that last night. Stood well, managed to hold his own weight. We did a little bit of a pivot. So today, hopefully, we can get him a little bit more activity. That's my plan.
Perfect.
Let's see, what else did we do with you? You ate. We're getting you good breakfast. He loves his
Tell you
breakfast.
what, he's a breakfast procurer.
Where there's a will, there's a way.
By the way, the food here has been fantastic.
Good.
I haven't had that much of an appetite. But, yeah, we had bacon, eggs, and pancakes this morning.
And you had an Egg McMuffin yesterday.
Yeah, well, that's Kathleen.
Yeah, that was Meals on Wheels.
All right.
We got a chest x-ray yesterday. It did look like he had a little bit of a right pleural effusion, so I know we were going to discuss potentially his thoracentesis today. Really, other than that, he's doing well. We've kept him on all the drips, Epi at 0.03, Primacor 0.375. In amio, it's 16.7 or 16.7 mils, 0.5 milligrams per minute. So, just kept him there. His blood pressure tolerated it well. Actually, we weaned him down on 2 liters of oxygen, but obviously he doesn't need any at the moment.
That's been off for a good 5 minutes.
Yeah,
So.
so truthfully, he probably does
We got
not need that.
Rosy glow.
And
Oh, go ahead.
that's really
I was just going to look through our list list
throw
there.
this.
Anything else we need to- the epi you talked about, stop CRT told us, PIC line.
PIC line, that's the plan for today.
Okay.
Potentially get that central line out, put a PIC in, and then talk this week about potentially putting in a tunnel dialysis catheter,
Okay.
because he's probably going to need dialysis again. I know his creatinine bumped back up to 1.61, I think, this morning. So that's probably, we're looking like going back to doing a little bit of dialysis, just temporarily, obviously. That's our plan, so.
What else we got?
Levi, were those labs from this morning, or were they?
No, well, those labs were the CBC, let's see, the CBC was from the 26th.
Okay, that's what I was thinking.
Well, and actually, I wrote down the 28th. I'll have to go back and look at that, see if that,
Do you have current labs?
that creatinine.
I don't know that we do actually.
I don't think we got anything. I'm not sure we got anything this morning.
The 26th was the last.
Yeah, it's creatinine on the 28th.
It was the
Okay.
28th.
Yeah, it's for the 28th, okay, that's,
The CB, or chemistry for the 28th, creatinine 1.61.
Okay.
So do we need lab for tomorrow?
I think it'd be great to check, and we want to check the platelets again.
Potassium's 3.3.
Great.
So let's do a CBC and a BMP in the morning, please. What else do we have up there on our list? Maggie, the cefepime, where are we at with that?
We are still on cefepime. We've got it for the pseudomonas, the grout and sputum. We will, with him being off of CRT and potentially doing hemodialysis, we'll watch renal function really closely to see if we need to adjust.
You know,
He needs to be on it.
he really never had a pneumonia, and it was just, kind of a tracheobronchitis with purulent sputum that he coughed up for like less than a day.
Okay.
And it's been almost a week that he's
Almost a week.
been on that now, so I think maybe if we just did a couple more days and then
Okay.
stopped or something
Sure.
like that, we'd
I'll
probably
put in a
be
stop
good
date then. I would agree with that.
And that central line had been in since a week ago, and I'm very excited to get that out, but he still is on, enough drips that I kind of thought we'd just switch over to a clean pick,
Okay.
today, and then get that
Perfect.
central line out. The dialysis catheter came out yesterday, no problems with that?
No problem
coming
with
out?
that at all.
Okay, cool.
Yeah, the problem is I have to lay still for 8 hours.
and the pressure I had to hold on it too,
Yeah,
right?
Yeah, that's all right. Go to the program again.
All right, stools, how are they?
Not loose, I mean, they're getting a little tighter.
They're getting a little better? Okay, me sells been a fiber.
Yeah, fiber's still on.
Okay.
It's embarrassing to have, clean you up,
Yes.
but goes with the territory.
It,
That's right.
it does,
Okay.
and you have the best person here to help you.
Yep, I'm certified in that. So.
He had to take an extra class for that one. All right, and then we'll talk about the meds here in a second, and the catheter we talked about, and the right effusion. Okay.
We still got a chest tube in, that left chest tube. How much did that drain, Levi?
Quite a bit. It's still draining. I think we had another close to 400 or 500.
Yeah.
So it's still draining decently.
So, and you have that tube still in on the left, around the left lung, and your x-ray yesterday showed that you have some more fluid that's slowly accumulating around the right lung. And I'd like to come back a little later on this morning, and we'll put a needle in, if that's okay, and draw off that fluid around your right lung just so we stay ahead of that. And gradually, as your heart gets stronger and fluid comes off, then we won't need to worry about those. But right now, we're kind of needing to stay ahead of that. So.
I was looking at the pillow, and it looks like a traffic accident.
There was a lot done. So.
Okay, and then I'm going to have Maggie read meds so we can talk about the other things on our list, and then we'll go around our circle here.
All right. So we talked about drips already. We're still on the amio, the milrinone, and the epi is still going. We do have aspirin and carvedilol that we've restarted. Are we giving the carvedilol though? Okay.
What's the dose? Are we at
It is
3.1?
3.125, just really tiny dose.
And Maggie, I wanted to just add in at that point, I talked with Dr. Pavey this morning, and he's okay with starting an ACE.
Okay.
And I was just wondering, Levi, do you think we have blood pressure room to start an ACE? Okay.
Okay.
He tolerated everything yesterday. I mean, he's been tolerating weaning, he tolerated CRT well. I think that
So,
Tolerate
so
it.
maybe lisinopril 5 or something like that, would that be
Do
okay?
you wanna start at 5 or do you wanna just start at 2.5?
Why don't we start at 2.5 and then we can give another 2.5 later on if he tolerates that well, if that'd be
Absolutely, and it looks
okay.
like he was on lisinopril at home,
Okay.
so I think that's a great
Is that
choice.
okay? So that's a medicine that'll help make it easier for your heart to pump that blood out. So, yeah. And then we may need to start some diuretics, but I'll let Brian decide those.
Absolutely, and we can talk to him about those. Let's see, so we said our aspirin and carvedilol, we're gonna add in an ACE. We talked about the benefiber that we're giving you, and then your levothyroxine
Yeah.
at home. Talked about drips. We've got Norco as needed for pain. You haven't had to use that too much though. And we've got his Levemir. I was gonna ask, do you want to increase that just a little bit?
What would you recommend? How are we doing,
We
Levi?
can even just be really conservative and go up to 15 units. We're at 13 right now.
The one thing
How
I
do you
did,
feel?
well, the one thing I did notice, yeah, he runs high during the day,
Mhm.
180s roughly, right around that range, but I've noticed throughout the night,
Mhm.
he's in the 80s,
Well, he got 8 units.
and maybe that's.
Supplemental.
the case.
Scale
Maybe
at
that's
about
the case.
midnight. So,
Probably did it too.
so we.
He'll never know 15. You want to go to 20, or do you want to just try 15 first? And
Let's try 15
Okay.
first, just because, you know, he was in the 80s this morning.
So that's
but
the
I think
insulin at
that's the
night.
sliding scale has something to
It's a
do
little
with it.
insulin at night. We're going to increase that up just a little to fine-tune your blood sugars a bit.
And we can just watch that sliding scale pretty
Great.
closely, but he's been utilizing that, I think, quite a bit. And
Great.
Levi and I can talk pretty
Cool.
a lot about that today. Zofran as needed for nausea, but you haven't had to utilize that too much. We've got heparin for blood clot prevention, those
Right.
little shots in your belly. Protonics for.
Which are a thrilling thing.
I bet you love those, right? Everybody tends to like those.
Can you make sure you note we'll check the platelets on that CBC tomorrow just with that. They've come back strong now, but I just
Yeah,
want
they
to make
look
sure they're
great
okay.
in the labs on the 26th, so. Let's see, we've got Protonics, for stress ulcer prophylaxis, and then the cefepime. And we've got the standard replacement electrolytes, which
Cool.
we replaced calcium last on the 27th, and really haven't had to utilize the
Okay.
mag or the potassium, so.
I do have a med question. We stopped his statin a long time ago. Should we look at restarting that, or should we leave well enough alone for now?
So I had made a note to ask you guys about that. So he was on Zetia before, which is really not my favorite. And I didn't see that he was on a powerful, like an actual statin. And so and I know we didn't restart the Zetia because of liver function, is that correct? Since I wasn't here last week. Whenever you guys are more comfortable, would you wanna consider a statin rather than a Zetia? I just think.
Mr. Tremblay,
we get a little
have
bit
you
more
been
bang
on
for
a
our
medicine
buck
called
with
Lipitor or anything like that, a statin medicine at home?
Not Lipitor.
Yeah. Okay.
So,
So Maggie's suggesting that we use a statin medicine. It will reduce the inflammation in your arteries and make it less likely for any new narrowings to develop. So why don't we go ahead and cautiously start something, Maggie? That'll be
you wanna do
fine.
the standard Pravastatin that we
I think it'd be
usually use?
fine,
Okay.
yeah.
Perfect.
And what I would recommend then is he probably doesn't need that Zetia.